Matthew Ziegelman, urologist at Mayo Clinic, here again with another Mayo Clinic Men's Health Moment. Over the next few moments, I'd like to discuss with you a treatment overview for men with Peyronie's disease. Treatment for Peyronie's disease depends on how bothered you are by the symptoms, how severe the symptoms are, how long they have been present, and whether or not you have any other conditions such as erectile dysfunction. Peyronie's disease is not cancer, so treatment is only necessary if a person is bothered by the symptoms or is unable to have satisfactory sexual intercourse. People who want less invasive treatments may consider observation, pills, or stretching of the penis. More invasive options include injections into the scar tissue of the penis and surgery to make the penis straighter. One of the most important things to consider when treating Peyronie's disease is the timing of the symptoms. Peyronie's disease is generally divided into two phases. The first phase is known as the acute or early phase. This is the time when there is active inflammation going on in the penis. Many men will experience pain with erections and sometimes even when the penis is not erect. Symptoms, including the bend in the penis, may get worse if not treated during the early phase. Even though surgery is not appropriate during this time, there are still treatment options available during the early phase to help prevent progression of symptoms and offer some improvements. The later or chronic phase is usually defined by symptoms that have not become worse over a period of 3 to 6 months. During this time, the pain usually improves or goes away. The bend in the penis and shortening do not get worse during this time in most patients. There are several treatment options for people in the later phase, including surgery. As previously mentioned, not all patients with Peyronie's disease require active treatment. If the symptoms are not particularly bothersome, or if they do not affect your ability to have satisfactory sexual intercourse, observation is reasonable. In the 1970s, it was actually thought that up to 50% of men may get better with observation alone. However, more recent studies have shown that symptoms only improve in about 10 to 15% of men, and that symptoms may actually worsen in 40 to 45% of men who choose observation during the first year. Most men will experience stability of their symptoms, meaning that the bend and loss in length in the penis will not get worse after a period of time. The pain, thankfully, improves or goes away in most patients. During that acute or early phase, treatment options besides observation can include pills, stretching of the penis, which is also known as penile traction therapy, and injections of medications into the scar. The goals during the early phase are to prevent symptoms from getting worse and hopefully improve the symptoms. During the chronic or late phase, stretching of the penis, penile injections, and surgery are all excellent treatment options. The main goal in the later phase is to improve symptoms such as the bend in the penis. Now I want to spend a moment to address erectile dysfunction, which is also known as ED. ED refers to the inability to get and maintain an erection for sexual intercourse. It is common. In fact, we see it in about 30 to 50% of men with Peyronie's disease. What is not entirely understood is whether erectile dysfunction causes Peyronie's disease or if Peyronie's disease causes erectile dysfunction. It is likely a combination of both. Why is this important? Well, men with erectile dysfunction are usually treated with pills. If the pills don't work well, other options include injections or vacuum devices. Treating erectile dysfunction alone will not improve the Peyronie's disease symptoms such as curvature. Also, treating the Peyronie's disease symptoms alone will not necessarily improve erectile dysfunction. In men who have both erectile dysfunction, specifically those who do not respond well to pills or injections, it may actually be best to address both the erectile dysfunction and Peyronie's disease with a single treatment, such as a penile prosthesis. We will talk about this in much greater detail in subsequent videos. This ends another Mayo Clinic Men's Health Moment, a look at the treatment options for Peyronie's disease. If you would like to schedule a consultation for Peyronie's disease or other forms of sexual dysfunction, please contact us at the number included on your screen. Thanks for your attention and have a wonderful day.